Would you know if a friend or family member was having a stroke? Could you tell if you were suffering from one? All day today, Channel 3 is joining Dean and St. Mary's to help you recognize the symptoms of a stroke. Joining us live from Mallard Stadium, where later today we're going to be holding an educational clinic, is Dr. Stephen Block, who's director of the Stroke Clinic at Dean and St. Mary's. Good morning, Dr. Block.
Hi, good morning.
So what exactly are we looking for? What are those symptoms that people should be keep their mind out for?
Sure. Well, anytime somebody has sudden weakness of their face or their arm or their leg, loss of sensation of one side of their body, difficulty speaking or understanding, and sometimes that can come across as confusion, but it may be a problem understanding language or getting words out, or sudden severe worst headache of your life, generally accompanied with a stiff neck and many times with exertion. Those are some big warning symptoms of a stroke, and call 911 immediately.
You know, it seems common logic, I think, to folks right now that if you're having a heart attack, you could take aspirin to try and help. Is there anything that individuals can do to help a stroke victim while they're waiting for 911?
Well, a couple things. One is call 911. Don't drive them to the hospital, because time is of the essence, and they'll get them to the hospital safely. There is no medicine to give. I wouldn't put an aspirin under their tongue. I'd make them comfortable. You know, loosen their clothing a little bit and just wait for the paramedics to arrive.
Doctor, there does seem to be a stereotype that stroke only happens with older people, but you can tell us that that's not accurate, right?
Actually, strokes can happen at any age. It can happen in newborns. It can happen in young children. It can happen in young adults. It really can happen in any stage of life, and various things cause that at different ages.
So what do you all do there at the Stroke Center?
Well, there are several things. Firstly, having a certified stroke center means that we have set up processes that allow for the very rapid evaluation and rapid treatment of stroke patients. And it's really built on the trauma center model, where everybody knows their role. We have timelines that have to be met. So people get evaluated very quickly in the emergency room. They're taken off to the CAT scanner very quickly. If treatment is needed, that's made very quickly. We have a team of physicians, both emergency room physician, neurologists, pharmacists, nursing, and so on, that are all radiologists, all there to rapidly evaluate the patient. Because really, the quicker that we can evaluate a patient and have them treated, the better the outcome.
All right, Dr. Stephen Block, the director of the Stroke Clinic at Dean and St. Mary's. We will be out there with you. Thank you so much for joining us this morning. Later on this morning, from 11 o'clock until 2 o'clock this afternoon, Dr. Block will be out there. You can join us at Warner Park in Mallard Stadium for a stroke assessment. News 3, along with the American Heart Association, are partners with Dean and St. Mary's about this. I'm going to be there along with my colleagues, Eric Franke, Karin Swanson, and Leah Linscheid.